Right, good morning everybody. Keith reliably informs me that we're now on telly, so no swearing. And hopefully we can fly through this exciting first meeting of our brave new world of cabinet structure. I wanted to just run through some kind of outline about how I plan to kind of chair these meetings going forward and just make sure we've got that consistency from the off. I think obviously this is a system and a structure that needs to last for 5 years, that needs to last across multiple administrations potentially, that needs to be coherent therefore in the way that it functions. So I just want to, in this first meeting, go through that at the beginning and make sure we set that out from the start. So as we go down the agenda, the relevant cabinet member or myself will move the recommendations in each report. There's no constitutional or legal requirement for us to second things like we do at full council. So in the interests of not faffing about, we're not going to. We will just move them in that way. Once the report's been introduced, I'll ask other cabinet members to comment or to raise any queries, and where it's relevant, where there's particular expertise within deputy cabinet members, I might ask them to come in. And we'll then, during the course of that, open up the debate to other county councillors who have requested to speak in line with the rules. I'm going to have a kind of informal time limit of about 5 minutes on those speeches, and some discretion in that. If you're making a highly interesting and exciting point, then fine. But work to roughly 5 minutes, always indeed. If you work roughly to that timescale, then we should be fine. And obviously those rules in terms of speaking will apply equally whether they are Conservative backbench speeches or opposition ones. As I say, it's got to last over a period. So I know we've had some debate this week about the structures and about who should speak and how people should speak. Obviously, we're all learning a new system from that perspective. So I just wanted to kind of, again, lay out what cabinet is and what it's for. So obviously, this is a structure where cabinet members can raise issues, debate things related to collective decisions that we have to take that cannot be taken through delegated powers. It's an administrative discussion from that perspective. It's not a policy committee, and it's not the case that we will have broad cross-party debate. I think speaking for backbench members or opposition members should be the exception rather than the rule, and I think that's consistent with what has happened in other places. Obviously, there are other forums, scrutiny processes for council, where there are more broad cross-party debates. But I wanted to reiterate the kind of criteria that I laid out in email yesterday. We've had nearly an hour's worth of requests for opposition speakers, and I've laid out a rationale as to why I've come to the conclusion that I've come to. So I'll do that publicly today, and then we can hopefully be consistent as we go forward. So in terms of rules, if you like, I will consider those requests on the basis of have we had proper notice of them. Wednesday 9 a.m. or the day before the meeting 9 a.m. is the deadline. It's a deadline, it's not a target in terms of timescale, so feel free to put those things in earlier. Is it directly related to the agenda? Has sufficient detail been given for us to be able to answer your question in the meeting, or to be able to ascertain whether it's sufficiently important to be raised at Cabinet? And have other efforts been made to answer those questions or to raise those queries through other means prior to Cabinet? As I say, Cabinet is the last resort of urgent matters as opposed to the first one. Every decision, or the vast majority of decisions, should go on a forward plan, and all members should have 28 days, therefore, to interrogate and to raise their points about those decisions that are made, and things that come to Cabinet should be where that hasn't been possible for whatever reason going forward. So recognising that I've only just laid that out here and yesterday, we'll be lenient on that today, and I've agreed that Labour members who would put one forward can have a speaker on each agenda item, and I'm happy to discuss that further with you next week, Kate, as well, as we go forward. So that will be the plan for today, and we will go from there and hopefully try and use that as a consistent set of rules in the future. So I think that's, for me, I think, as I say, that is consistent as far as I'm concerned with other areas. As far as I'm concerned, Gedling don't have any right to speak at Cabinet. Ashfield, I think there's been a handful of examples over a number of years. In government, of course, Cabinet is a private meeting where nobody else gets to go. So I think we are in a reasonably open position from that point of view. So we go down the agenda then proper. Any apologies for absence this morning?
I have apologies from Councillor Taylor, who has a family commitment that was unavoidable, but Councillor Anderson is here in her place.
Any further? Nope. Great. Declaration of interest. Any to declare disclosable pecuniary interests or private interests? No. Agenda item 3 is terms of reference, really just for noting. It was approved at full council, but again on this first meeting of Cabinet, just to reiterate and to note what we are here for and why. If anyone's got anything they wish to question or raise within that, now is the time. Although, as I say, we've already agreed that at full council. No, this is as smooth as it could possibly go. Good. Agenda item number 4 then, key decision on the Nottinghamshire Joint Health and Wellbeing Strategy. I ask Councillor Barney to speak to that.
Well, thank you very much, Leader. And I'd like to say what a great joy it is to be introducing this first key decision item in our new Cabinet structure. And what a wonderful report it is we have before us, the Nottinghamshire Joint Health and Wellbeing Strategy for 2022-2026. And I'm enthusiastic about it, but there's a man in the room who's even more enthusiastic about it than I am, and that's Councillor Dr. John Doddy, who I'd like to invite to talk to the report. And as I do so, I move the recommendation as set out on page 12 of the report. Thank you, Councillor Doddy.
Thank you, Councillor Barney. If all this excitement continues throughout today, who knows what I'll be ended up dealing with here today. But that's the type of thing that you get with new cabinets and new developments. And I'm delighted to be here this morning to present the Joint Health and Wellbeing Strategy 2022 to 2026. The purpose of this is to seek approval from the Cabinet, and we have to seek approval because the health and wellbeing strategy is such a wide-ranging strategy that touches every single community for which all of us represent. And that's why it has to be approved by the Cabinet. If we look historically, I remember back when I started out here in 2012, that was when the then Secretary of State, Andrew Lansley, introduced his Health and Social Care Bill, which introduced health and wellbeing boards to county councils for the first time and gave us nothing less than a statutory duty to produce a health and wellbeing strategy. This is the third such strategy that I've been involved in. We had 2012, 2016, 2017, 2021, and now 22, 2026. This is informed by our other duties, which are to produce joint strategic needs assessments, which look at the entire population of Nottinghamshire and decide what the needs of those various communities are. Then they are then amalgamated into a strategy, that of which I'm presenting for you today. Everybody wants to live happy, healthy, longer lives. And in Nottinghamshire, that's what we want to set out to do. The average person in Nottingham who's a male probably lives to 79 and who's a female maybe to 81. But the dramatic thing is that they get ill at 62 and 63 respectively. So the average woman will get ill a number of years before she retires and then live the entirety of her retirement in ill health and then die. Similarly for a man, although men get ill slightly later. It's against that background that we set out our vision. And our vision was to work together to enable everybody in Nottinghamshire to live healthier, happier lives and to prosper in the communities in which they live, and most importantly, to live independently into later life. We set out doing this with 4 ambitions, and the 4 ambitions to help us deliver the vision were to give every child the best chance to maximise their potential. What more important than to give a child the best start in life? To create healthy and sustainable places. So the places that we live are healthy to be in, allow us to walk, allow us to cycle. To give everybody access to health and abilities to improve their well-being, and most importantly to keep people safe in their communities, particularly those most at risk and those with the greatest health inequalities. In order to deliver those 4 aims, we set out 9 priorities. Those 9 priorities were the things that we thought were deliverable. There were areas that we thought that we could actually reach into and change. And we started off with giving everybody the best start in life. The best start in life actually starts before you're even born. It starts stopping the mother smoking in the antenatal period. It's safe deliveries, and it's those first 5 formative years before you get to school. Secondly, mental health. Who cannot have been aware of the significant impact that COVID has had on the children of Nottinghamshire in regards to their mental health, and indeed the entire population? And it's an all-age approach to mental health. We are going to look at food insecurity and nutrition to give every child the opportunity to things such as our potentially award-winning children's trailblazer obesity projects, an opportunity to have good nutrition. We're going to look at homelessness. Homelessness gives everybody who lives on the street the greatest disadvantage that ever existed, because the average age of death is as low as 47 if you habitually live on the street. We're going to tackle tobacco, the big issues, still a killer of 70,000 people every year, and still the greatest single cause of health inequality that exists anywhere. 50% of all health inequality still caused by people smoking. We're going to look at alcohol. If you look at Nottingham alone, in the population of 820,000, 170,000 people have been identified as potentially benefiting from substance abuse interventive help. Domestic abuse, just coming back to keeping everybody safe again. Healthy weight. Healthy weight is something which we're all aware of, that there are places in Nottingham where people are on average 70% of them overweight or obese. Kids going to school, 10% of them are obese. Getting to secondary school, 20% obese. So weight will become a central theme throughout the delivery of this strategy. And the bigger issues like air quality, which affect all of us every day. Now, how did we come up with this strategy? We came up with this strategy by consulting the public. We consulted them online. We went out to visit them. I myself went out to Rushcliffe. I went out to Newark. I sat in Beeston Library addressing the public. We put hundreds and hundreds of opinions together and listened to every single one of them, held a workshop on the 23rd of March 2022 and formulated the health strategy that you see before you today. This strategy is delivered in 3 forms. The public-facing form, which is a beautiful, easy-to-follow guide for the public, which is available for everybody, an executive summary, and a tome of 200 pages of detail for those people who want to look into the depths of the various strategies that are involved in coming up with this health and well-being strategy. So, ladies and gentlemen, I put to you the health and well-being strategy for the people of Nottinghamshire 2022-2026 for your approval. Thank you.
Thank you, John. Very comprehensive, as ever. I think pleased to see this come forward, and particularly, it's a theme throughout the agenda and the reports in there today, that we're picking out what it is we're trying to achieve and how we're going to measure it. And we'll hold ourselves to that over the coming years, which is an important factor. I think it may seem small, but actually setting ourselves those outcomes and those goals is important. Are there any members of Cabinet who wish to speak or raise anything on this agenda item? Bruce?
Yes, thank you very much, John. I welcome your report. And what I welcome more than anything else, and we fed this through with the Nottinghamshire plan, is the emphasis on mental health and the importance that is in the communities that I represent, and I'm sure many other members represent across Nottinghamshire. It is a ticking time bomb that we have to deal with, and the level of support that's required needs the emphasis coming through from your plan to be able to try and improve the situation.
Through to John.
Yes, thanks, Councillor Lawton. Nobody can have escaped the huge, significant adverse impact on mental health that COVID has had over the last number of years. And the mantra, no health without mental health, has never been more important. Only this week, I saw the approval of funding to make every school have the availability to be able to skill up somebody as a mental health work practitioner within those schools, and that funding is available in Nottinghamshire. And it will be a core part of our delivery. The Health and Wellbeing Board has such a thing as a mental health concordat already, where we've had workshops, where we've signed up companies to have a mental health leader. That leader would be in much the same way as somebody would recognise physical ill health, would pick up on mental ill health and be like a mental health first aid worker. And those things we've already held extensive workshops on, signed up multiple agencies and providers to those, and we'll be revisiting those over the next number of years. So yes, no health without mental health, Councillor Lawton.
Thank you, John. Councillor Barnfather.
Yeah, thank you, Leader. Well, we started off the meeting with that real feel-good factor and buzz in the room and a smile on our faces, and then I listened to John's statistics that I'm going to die very soon, and if I don't, I'm certainly going to be very ill very soon. So I'm thinking of standing down tomorrow. There could be a by-election in Newstead very soon, so I can live out my remaining years in happiness and health. No, on a serious note, the statistics, John, that you put in the document here are very sobering. And I think it's actually good that they are brought to our attention, because we do take our health for granted. We do take, I suppose, our quality of life for granted. We do tend to take a life expectancy for granted. And I think it's important that we understand that it isn't all achieved by chance, that there are many, many things that as a community, as an organisation, as a local authority, that we can do to actually support, hopefully, the longevity of life and the quality of life before you reach that final stage. So I thank you for the report. I do like the way that it's laid out, with the, if you like, the very simple introduction there for the public to be able to pick up and read easily and understand, and then obviously the more detailed documents at the back that effectively they're more for the practitioners, I suspect, than the average member of the public. Just picking up on the mental health issue, one of my daughters is a teacher in Nottinghamshire, and she is also the lead in her school for mental health issues, and I know the problems that many schools are experiencing, and it tends to be hidden effectively. It's a hidden problem, not just COVID related. It's an ongoing issue, but I think COVID has exacerbated the situation. It is a significant problem for schools to be able to manage. Not necessarily a significant problem in every school, but when it is a problem, it's an issue for schools to be able to manage. So the support that we're putting in there to support the teaching professionals to be able to support the welfare and well-being of their students, again, is much appreciated. And I think what always comes through, John, with everything that you do is your passion. And obviously the fact that you are a general practitioner by occupation, as well as being an elected member, you have that background knowledge that it's not a case of you signing off on a document that somebody's been prepared by somebody else. You can tell by the content of the papers that we have before us, your passion, your knowledge, your experience, and the driving force that's behind the paper that's before us today. And the important thing is, it's not just a piece of paper. It's going to be a living document, and it will form the basis of how we as an authority try and improve the quality of lives for our residents. So I thank you.
Thank you, Chris. And feeding up, of course, into our wider council plan, all of which we should be able to see through most of the decisions that we take in this forum, that connection back up to those key ambitions that we've set out over the course of the last 12 months. Councillor Girling.
Yeah, thank you, Leader. I think I'm probably quite a few of these statistics on here, John, actually, so I'll try and breathe in a little bit while I speak. I think in terms of the mental health issue, as the Armed Forces champion, that's obviously clearly quite a significant part of what we try and do within that element of it, and they call it the hidden wounds. And that's the problem, isn't it? It's hidden and often very difficult then to put things in place that's going to actually deal with those particular issues. So, you know, I really welcome this report. It's very well thought out and easy to understand. I suppose in terms of the 4 ambitions, number 2 comes under my remit as the Economic Development Asset Management Portfolio Holder. And I just want, I think it'd be beneficial for members of the Cabinet to understand really that any land that we own where we're selling it for housing, we look very carefully on who we sell that land to. And if their idea of using that land is to fill it with boxes and cram as many in as possible, then they will not get it. And if that comes at a cost to us, then that comes at a cost to us. We look very carefully at the developers we deal with, so they can put in houses that are sustainable, are big enough for people to actually live in, and don't cram them all in. So there's green spaces around there as well for people to enjoy the amenities of where they live. It's about creating homes, not houses. So I just want people to understand that. Thank you.
Thanks, Keith. That's helpful. As you say, it cuts across everybody's agenda, doesn't it, from that point of view? Hugely impactful issue. I've been notified of one opposition speaker, Councillor Welsh, and then I'll come back over here. Michelle.
Hiya, thank you. Firstly, I welcome the fact that we've even got a health and wellbeing strategy. I think it's extremely important. It's also extremely unnerving that Councillor Doddy sat so close to me. So yeah, firstly, I welcome that. Health inequalities is something that is quite very important to me, and something I feel quite passionate about, and I hope that it's, and I've said this before, that it's a priority for you, Ben, when you're moving the devolution agenda forward. Seems we still have a 7.5-year difference between those that live in the south of the county and those living in the north of the county. We've not really got to grips with that. So I welcome the 9 areas of focus. They're obviously really, really important. I have a few concerns. One we spoke about already with regards to mental health. So over 90% of the participants selected mental health as one of the top priorities for them and their family. A study by Birmingham University on the impact of COVID on young people aged 11 to 15 showed that mental well-being of those from less affluent backgrounds was significantly more impacted. I would have assumed that the provision of mental health services from family hubs would have been mentioned in this strategy somewhere, but it isn't. So I'm a bit concerned about the lack of funding this council is set to receive for family hubs and the impact that this could possibly have on the way we deliver mental health services for children and young people, especially in the areas that need it the most. I do welcome as well, Councillor Dolly, the members of staff in schools, but it is worth mentioning that schools feel very under pressure at the moment with budgets and staffing, and that any pressure that we can put or any extra funding we can find for additional NHS workers perhaps to go into schools would be very much welcomed. And certainly when I worked in education, that was a regular thing that happened, and it was really effective and actually made a huge difference. So the pressure isn't already on teaching staff or school support staff, because it is a huge issue in schools. The second thing is with regards to best start in life. It says children have access to high quality early years provision. Again, I go back to the family hub settings again, which we seem to have had a lack of funding for. There isn't any mention of the family hubs in the strategy yet. It's a government key objective to dealing with early years issues and including childcare. It's not in the strategy anywhere, and I'm just wondering whether it was going to be updated to feature that, because it is such a key thing, especially with health and wellbeing for young children. And I wouldn't be me without mentioning, I don't think, the fact that in this health and wellbeing you have mentioned mothers and babies having positive pregnancy outcomes, which is on page 11. So, of course, I welcome anything that goes towards keeping babies and mothers safe, such as preventing smoking in pregnancy, substance and alcohol use, healthy weight and good nutrition, screening and immunisation, all of those things. I completely welcome that. I'm a little concerned that this paper mother shames a little bit, because the biggest problem that we have here in Nottingham and the biggest deaths of babies is not caused by smoking in pregnancy, it's caused by poor care in our hospitals. The fact that Maria Coalfield, the Minister for Patient Safety and Primary Care, cancelled a meeting with ourselves, the Chair of the Health Committee and myself at last minute due to departmental reasons with regards to what was going at Nottingham University Hospital Trust is certainly quite worrying. I know there's been some movement. I know NHS England have done a review on our review and we're waiting to hear the results. But what I would like to see in our health and wellbeing strategy is how we move forward and work together with NUH with regards to perhaps improving that care and how you work with families with regards to that. It says ensure swift referral pathways are in place for expectant parents who are deemed as vulnerable. You know, there's a lot of work that needs to be done, that a considerable amount of more work. So I would ask again that the leader puts his voice to holding a public inquiry into the inadequate maternity services in the county, and this should be reflected in the health and wellbeing strategy of how we go forward.
30 seconds, Michelle.
Sorry, last but not least is good food and nutrition for all. Food on the doorstep. We can buy weeks. Apparently, you can buy a week's worth of shopping for £3.50, which works out at 50p per day. A bit different to 30p per day. These clubs are in the majority of them are in our most disadvantaged areas, our most poor areas. So I would suggest this isn't food poverty, it's actual poverty. And we need to address that. If we're really going to address health inequalities in Nottinghamshire, we need to address poverty. Thank you.
Thanks, Councillor Welch. A number of points there that I will send out. I think worth, from my perspective, go back to the beginning, you mentioned devolution there, and there are huge opportunities through that, particularly for children and young people, I think, where we're looking at what we can do around youth work and around family hub kind of settings in terms of devolved powers and funds. You touched on family hubs, of course, in more detail. I might ask Matt or Colin perhaps to just give us a second on our family hubs approach, because obviously we're doing that work regardless of government funding from that perspective as part of our transformation programme. I think Councillor Taylor touched on in the previous meeting that we're not waiting for or have not lost out on funding for that. We are already in the process of delivering some of that work. Maternity, of course, is a key issue. And we know Maria Coalfield has postponed a meeting until new information is available and appointments have been made, not least a new excellent chief executive who will be headed over in that direction. So we are waiting for a new date for that rather than cancellation. John, was there anything you wanted to add? And
Yes, I think that obviously all very important points raised by Councillor Welch, and the reality is that the strategy that we've put forward has also been backed up by a task and finish group specifically to monitor and evaluate the outcomes of the things that we've set out to achieve. We have put a depth of monitoring into it that means that this is a learn and build model. We have looked at our outcomes and what we wish to achieve and decided that we will have a multi-level approach to achieving those outcomes. So we look at it from a system-based, say, Nottinghamshire, are we living happier and healthier lives? We look at it from a place base to say, are the communities in which we live improving? And we look at it from a priority base to see, are we hitting the targets on giving every child the best start in life? Are we improving the smoking, etc.? So we will have a multi-level, constant approval of what we're trying to achieve, as well as a mixed method, quantitative and qualitative assessment of those figures, which we will be analysing, which I'm sure the Director of Health will agree, on an annual basis for the system and on a quarterly basis for place and priorities. Within all of those, it will be, what did we set out to achieve? Are we achieving it? Are we giving every child the best start in life? And adjusting as we go along. Learn and build a live website covering all the priorities that we've laid out, and adjusting as per those outcomes. So we've put in substantial chair monitoring and evaluation systems to deal with exactly the type of query that Councillor Welsh has brought forward. Thank you.
Thanks, John. That's helpful. I said I'd bring people in, but actually, Matt, if I come back to you if there's anything you want to add, and if you want to bring anybody in, feel free. But any further response?
Thank you very much. So one of the great joys for me over the last 12 months of having been elected is getting to know other people in this chamber, and not least Councillor Michelle Welsh, who when she speaks, often it's like listening to myself on many of the themes and topics that she brings into this chamber. Her passion and her priorities and her advocacy for young people is very heartfelt and very well received by me, as she well knows. And so I thank her for bringing forward the comments she's brought today. Actually, I'm also quite grateful to her because it's almost like she introduced brilliantly the next agenda item, which is coming forward, which I think her targeted list of priorities there, many of which, if not all of them actually, are picked up on in the next paper coming forward, where we will be supporting Best Start coordinators. There's more funding for food clubs, and other key priorities as well. And family hubs, absolutely, as you touched on, Ben, central to our core strategy, where we're at as an authority and where we're looking to move forward going forward. I'm delighted to be in this seat and being able to have some influence over these matters because, like Michelle, they're of great concern to me on a personal basis. And I look forward to working with Michelle and everyone in this chamber to deliver these key priorities. But Colin, is there anything you would like to say particularly just on family hubs in particular in response to Councillor Welsh?
Yeah, thank you, Councillor Barney, and if I may, through the chair. Family hubs clearly mean an awful lot of different things to an awful lot of different people. Yeah, Nottinghamshire is very well placed to deliver the support in early years and early help, yeah, because of the recurrent protection and continual investment in our early years provision. Yeah, in the next paper, I think page 56 and 57 both make direct reference, yeah, to family hubs. Before government decided whether we'd be receiving any additional funding from central government, we'd already committed through the Children and Young Persons Committee to establish our first family hub around the Retford area, and we've got commitment to do two further family hubs. So I think we're very well placed, despite not being a benefactor of the first tranche of additional central government funding. That's not to say there won't be further funding coming down the road that we'd be very grateful for.
Thank you very much. That's helpful. Councillor Barney, I'm delighted that you're in your seat as well. Very good. Good. Councillor Clark, did you want to come in?
Oh, thank you, Chairman. Well, it was only just following on from comments that Councillor Girling made. It's only just the reason this strategy is so important is because it cuts across all the areas of activity of the council, no matter who we are. And just two examples for me. You know, we've got a programme of planting a load of new trees over the coming years, 170,000. We're now investing in electric buses, so that helps with the air quality, etc. And then with promoting and encouraging green parks, water corridors, leisure corridors, it all helps with the mental health and well-being. So, as I say, it cuts across all our areas of activity.
Thank you, Neil. That context is helpful and from a cabinet perspective, being able to share those kind of areas where it does cut across everybody's portfolio is what we're here for, so that's helpful. Any further comments on this agenda item? No, great. In that case, I just need to ask for a show of hands for all those in favour. Thank you very much. That is carried. We'll move on to agenda item 5, investing for improved public health outcomes, which is also you, Matt.
So me again, sorry, I hope that the Cabinet won't continue on this basis with me speaking so much, but again, pleased to be bringing forward this paper, but touching on the tone set by Councillor Barnfather, it is with great sobriety and seriousness we bring forward this paper because whilst it's all very good news, whilst it's all fantastic that we're providing very targeted support in line with the joint health and wellbeing strategies we've just discussed and also our Nottinghamshire plan, we're very aware that the priorities that we're bringing forward here are to address the huge and significant imbalances and disparities that there are across Nottinghamshire. Again, as Councillor Welsh touched upon, we're very aware of them. And that's why I am pleased yet again to be bringing forward this report, which seeks, with very substantive measures and lots of money, direct, targeted measures to address some of those imbalances and disparities. To pick out just a couple, so the food clubs on our doorstep programme, I'm thrilled to see extra support coming forward for that in this paper. More money for the existing rough sleeper initiative, something which I'm very keen to see a lot more work and direct support going towards. Funding for a strategic mental health lead post for Nottinghamshire schools. Again, that's already been discussed much in this chamber this morning, and the need to target support for mental health, particularly with young people as we come out of COVID. So pleased to see that in there. And more money as well for the Best Start in Life initiatives, again, as we've discussed already. So all really good. I'm delighted to hand over to you, Jonathan Gribbin, to detail more elements of this report and to enlighten the committee with further aspects for it. But as I do so, I move the recommendations, which I believe are set out on page 42 of the report. Thank you, Jonathan.
Thank you, Councillor. And Chair, I'll say a word or two, if I may, just to build on some of the themes which councillors around the chamber have already touched on. So, of course, developing good health and well-being for people in all of our communities is, pardon me, central to the health and well-being strategy, which, of course, is a partnership strategy for organisations across Nottinghamshire. It's also really central to the Nottinghamshire plan that we'll hear about more later on in the agenda. Thank you. Of course, the ambition behind this is that people right across Nottinghamshire, amongst other things, are also able to live independently for longer. And we find that good health and well-being underpins, of course, a range of other important outcomes. So some of the outcomes that we're concerned about in terms of inclusive growth, community cohesion, and environmental sustainability. And the purpose of this report, then, is to consider how we can strengthen the contribution that the Council makes to this wider partnership effort and into delivering the Nottinghamshire plan, and is very much about improving those health and well-being outcomes. So the key building blocks for good health and well-being include those things like getting a best start in life, education and skills, getting access to a good diet, secure employment, good housing, relationships with family, friends and community. And in some communities we find those building blocks are very strong. In others we find they are weak or missing. And that leads to some really very sharp and stark disparities in health outcomes that a number of councillors have already commented on. And the opportunity, and indeed the imperative for us with the public health grant, is to address those. So if I say a word or two about the public health grant, which the council receives each year, it has a strict ring fence around it, which means that it must be spent on delivering public health outcomes. Underspend in that public health grant might arise for a number of reasons, including in the last couple of years because of deflection onto the COVID response, which has meant that we have not spent as much as we would have liked on other public health outcomes. So as a result of that, we have accumulated some reserves, and on the current assumptions that we have been given about the potential growth in the grant over the next few years, we're forecasting that if we did nothing else, we would accumulate something in the order of £8 million of uncommitted reserves over the next 4 years. So it's really important that we get to work now in investing those for maximum impact for residents. And this suite of proposals has been developed then to do exactly that, and to do it in a way which is fully aligned with both the joint health and wellbeing strategy that you've heard about and also the Nottinghamshire plan. So the proposals are designed to have greatest impact where the need is greatest, and it's really focused on increasing the number of years in which people in all of our communities enjoy good health and well-being. So to that extent, it will also support the medium-term financial strategy of the Council, because it will also reduce some of the future demand on services provided by the Council and other public sector organisations. Thank you. That's enough from me.
Thank you. That's very helpful and comprehensive. And again, looking through the documents, really appreciate the way that this is formatted and laid out so clearly in terms of what it is we're going to do, the rationale, what it is we're aiming to achieve. And I hope that as we go forward, we can get that kind of clarity in everything that we're trying to do. Does anyone else wish to speak on this particular agenda item? Gordon.
Thank you, Ben. It will be very brief. I'm delighted to see on page 42, and Matt, hopefully you and I will have a discussion together with my deputy as we go forward, an investment and apprenticeship public health support. You know, with an awful lot of work we're doing in apprentices within this council. I'll touch on it again a bit later. I look forward to working with you, Matt, as does Jonathan as well. It's great news. Great to see this in the report. Thank you, Leader.
Thank you very much. That's helpful. Any further cabinet speakers at this stage? No. In that case, I've been notified that Councillor Henshaw wishes to speak on this item.
Thanks for bringing me in, Chair. Before I start, I'd just like to say thank you for allowing members of the Labour group to speak. I mean, obviously, I think that that's a wise decision because as we move forward, I think our contributions will be helpful to you and to your cabinet in your deliberations in the future. So thank you for that. In relation to the report that's before us, I think we're all from our side in favour of and accept the report, and we're looking forward to working with Councillor Barney in the future. But it would be remiss of me not to actually mention a few issues which sort of touch on the previous report, because obviously that strategy is vitally important for the way in which we try and improve the health and well-being of the residents of Nottinghamshire. And as Councillor Doddy quite rightly mentioned, if life expectancy is something that we are wanting to achieve, then it's important that the life expectancy is one of a healthy life expectancy. And I think the processes and the issues outlined in the previous report, if implemented and if followed through, will hopefully achieve that. It cannot be right that some residents of my division in Mansfield West have a shorter life expectancy than people in, say, areas of southern Nottinghamshire and Rushcliffe, and that imbalance needs to be redressed at some point in the future. If members haven't read, they should look at and read the Marmot report, or the Marmot report 10 years on, which indicates a lot of the problems that have befouled all governments to try and move against this sort of imbalance. It's one of the things that we all want to achieve, and I think it's an area where county councils and councils in particular have a major role to play and are particularly relevant in delivering those improvements. In relation to the plan, I think, yeah, it's great. Let's have a plan. Let's action it, and at the end of the day, let's look at it and review it to see where we are moving to, and look at possibly areas where we are failing so that we can improve. I think education is vitally important. I mean, it's anecdotal, but as I drove by one of my local schools at end of the day, I seemed to see lots of young people sat on a wall, all smoking. You know, and this is after years of education trying to tell young people and older people that smoking's not good for you, and if you smoke, you're going to end up shortening your life. So in areas like that, it's vitally important that we try and get people to listen and try and educate. But in relation to the report in front of us regarding the finances, I've got a question to Councillor Barney through you, Chair, and it's basically, based on the current planning assumptions, uncommitted public health grant funding is forecast to increase to 8.4 million by March 2026. The investment proposals in this paper totalling 4.92 will reduce this to an estimated 3.9 million. Further proposals will be developed for the investment of this remaining amount within the next 6 to 12 months, subject to work currently taking place to quantify emerging cost pressures within the existing services commissioned. Like I say, I'm glad that there's funding available, which for many years we've looked at, and it's not been spent through slippage or for whatever other reason. So in saying that we support the paper, could I have an explanation in relation to that Matt, and we'll see where we move from there. Thank you, Chair, for letting me come in.
Thanks, Councillor Henshaw. Appreciate your comments. As you hopefully, after a year, have come to know, try and be as inclusive as we can within the confines of trying to make sure we have a fit-for-purpose meeting in the same context, but we will try and do that as much as we possibly can. Councillor Barney, did you want to come back on the question?
Very much like to, actually. And just very briefly to touch on your comment about smoking there. It absolutely breaks my heart and to see young people smoking to the degrees that they still do. With my own 4 children, I've been absolutely perplexed as to why I've on occasions found them with boxes of cigarettes in this day. I cannot believe where we're at. But more than that, the whole vaping pandemic as well, and vapes to include nicotine, I just do not understand it. And God, I wish we could get a message out together in this council that stop, just pack it in, quit. This is ridiculous. Anyway, I digress. Your specific question about funding, yes, the number's there, 4.92 million that we've earmarked in these proposals, with 3.9 million remaining on the table. We will be bringing together a comprehensive suite, building again a very targeted response in line with the joint health and wellbeing strategy and the Nottinghamshire plan to allocate that money over the next 12 months. For my mind, and it's interesting, I've had this debate with the officers on both sides of me here, I'm a man of prudence. I like to save for a rainy day just in case, but the outside of that is there's need now, and we need to target that need now. And I get both sides of the equation on that. But I'd like to assure you that we will be bringing forward this money, and with my prudent hat on, I'm glad that we've still got some in reserves just because of the inflationary effects that this country is currently facing with the cost of living crisis. So I think it's the best of both worlds. We've spent more than half in these proposals. We will be spending the rest, but it's just nice to have some reassurance. We don't know quite what's going to happen over the next 12 months, and so not spending it all now seems like the sensible approach. I hope you'd agree. Thank you very much.
Thanks, Councillor Barley. That's a really helpful response. Any further Cabinet comment or question on this? No. Very good. Right, in that case, just need to ask to approve the recommendations, which is the investment as laid out in the document. All in favour? That is carried. Thank you very much. Right. Agenda item number 6 and 7, which we're going to debate together. The content, as you'll have seen in the reports, is largely the same and covers just past and future of that council plan in terms of both annual report and our delivery plan going forward. So I'm going to ask Councillor Lawton to move both reports, if that's okay.
Yes, thank you very much, Leader. Right, both these reports have one main theme running through them, and that is intervention to ensure that we improve the level of service that we deliver to the people of Nottinghamshire, and that doesn't matter whether it's highways, adult social care, young people's services. Written large throughout the whole of the report is our ability to be able to improve our service delivery to the people we represent. Now, this was given to us really by the people of Nottinghamshire when we went out and asked them what they wanted, and that's what they came back with and told us to do as an administration. And so written within this both these reports is that theme. Many of you Cabinet members are involved in these schemes, and I'm sure some of you will be talking on those issues in a minute or two. But it is important to us that it's that question, isn't it? It's that serious question. Just because I'm doing the same thing time and time again, is it right? Is it the best way of delivering something? It's the question we should all be asking ourselves on a regular basis to ensure that we're not just doing the same old, and accepting that as being good enough as far as the service delivery is concerned. So I will move the recommendations. The first recommendation on page 68 is for noting, and the recommendation on page 114 approves the annual delivery plan. Thank you very much, Leader.
Thank you very much. That's helpful. And I will invite colleagues in Cabinet to just touch on the areas within their own portfolios as we go through the plan, because it is comprehensive, and Unusual probably for these meetings that it does cut across basically everything that we do across the council. We'll probably find over the course of future cabinet meetings that there's very little that does so in the same way. So a good opportunity perhaps to share information and updates within this forum as to what everybody is up to. Important, obviously, in this new system that we find opportunities to do that going forward. So within my own area of responsibility, I suppose, aside from being the leader, I typically look after the external bits and, of course, our regional and wider partnerships and strategies in terms of our economy, all of that kind of work that we have discussed at length before. So progress, I suppose, up to this point has been rapid, I think, in the last 12 months, with issues like our East Midlands Freeport, which is now plan submitted, and we expect to be operational very soon. East Midlands Development Corporation, where we've secured the match funding that we have been seeking to bring forward the master plan for sites like Toton, which are obviously hugely important to us and our wider county economy, tens of thousands of new jobs and infrastructure linked to those projects. And of course, we continue to work now on plans going forward for projects like Step Fusion Energy in West Burton, which along with officers will continue to push for. So all sorts going on in that space. I also wanted to flag in that kind of economic bit some additional funding that we have received from government, which is in our delivery plan, and you'll be able to read about in more detail, but a project called Multiplier, which was born in Nottinghamshire and stemmed from conversations with West Notts College and myself. So it's fantastic to see that funding come forward to tackle, when we talk about some of the health inequalities, actually some of those basic skills like adult numeracy and the ability to get into meaningful work and to have that quality of life, I think are hugely important in that context as well as the wider economic one. So really pleased to see that investment come forward and looking forward to being able to announce more details of what that will look like. And then, of course, a major priority for us as a council and for a region as we go forward in terms of delivery is our devolution deal. And we have made further progress on that. We have had assurance now from government that we will put together and do our negotiation over the course of this summer with a view to confirming a deal in the autumn. We've had a steer now from government that we should expect to hold an election for our East Midlands Combined Authority in 2024 at the latest. Which is helpful certainty from our perspective. And we're beginning to now lay out the potential, and we've done so in Economic Prosperity Committee recently, about the cost-benefit analysis of what all of that work means to our residents, and the headline figure of £13.60 in terms of additional public sector funding for every 90 pence that we spend is one that we should all welcome, I think, and we should all be on the same page in terms of absolutely wanting to bring that extra support into our communities. The things that can do and will do in terms of all the long-term health, well-being skills and work strategies that we are bringing forward across the council. That is, of course, before we get into potential private sector funding that can be levered in through that structure, through things like our development corporation and what that means for jobs and infrastructure. So that is hugely important within my portfolio, trying to draw in government into that negotiation and make sure we get the absolute maximum from that we possibly can. Councillor Lawson, if I can come back to you in terms of your transformation portfolio.
Thank you very much, Leader. So with four main streams I wanted to talk about. One is the Early Help and Preventative Interventions programme, which is designed to help people at the early stages of need. And this is specifically important on the basis, particularly with some of the fallout of the COVID pandemic. The second thing we are concentrating on is improving our residents' access programme. This obviously has major benefits. It means that people can tell us earlier when there is a need for a service in their particular area. The third mainstream we're looking into is our whole family safeguarding programme. And again, this speaks for itself, really. It means if we can get in and deliver a service into a family early, it stops the progression of any further need as far as the council is concerned, and helps with our ability to be able to deal with more residents across Nottinghamshire. And the last area that I wanted to really highlight is our all-age approach to the disability programme. And this will improve and develop as we support more young people in the community. As part of our transformation programme, we felt it absolutely necessary to deal with early intervention. It has major benefits for this council. It has major benefits for our finances. It has a major benefit for the people that we deliver a service to. And it is parcel of our change agenda that we're driving forward on both these papers that have been put forward to you today. Thank you, Leader.
Thank you very much. I think I might just go down my attendance list and ask people for a sense of their departmental priorities, and of course any questions and queries that come up as well. I've got Councillor Barnfather next on my list.
Yeah, thank you, Leader. I don't have a big budget like adult social care and health, or children and young people. You know, you look at my title, Cabinet Member for Business Management, and it's a little bit vague because my role, I suppose, is a little bit vague. Business manager, business manager, chief whip. You know, I'm called lots of things. They're the polite ones. I won't go into the others that I'm called by some members in my group. I see my role as a bit like the oil in the machine, effectively, that it's to make sure that all the component parts work to produce the end result, that they don't rub against each other too much in the process, which means that the engine doesn't work at the end of the day. So I'm behind the scenes. I'm not front of house like these guys. I'm the guy doing the washing up and the ironing, in effect. You know, and I'm a humble person, and I understand that my role is to shine their shoes, to make sure, and comb their hair, to make sure that they look good in front of the cameras. And I like to think if I forget to bring the comb or the shoe polish, that they may not look quite so good. But I suppose my principal role over the last 6 to 9 months particularly has been in relation to the transition that today is evidence of. So that transition from a committee system to a cabinet system. You know, I have to thank the opposition, the Labour group in particular, who we've worked very closely with to be able to produce effectively a new constitution. And without the role of the monitoring officer and the legal team and all the other officers that have been involved in that process, we would not have received that unanimous support at full council to be able to make this transition. And we didn't make the transition just for the sake of let's do something different. We made the transition to make us a better, more cohesive unit, and one which the government would look more favourably on when we are looking at that devolution deal. And the leader has already talked about the massive potential benefits to Nottinghamshire and its residents by that deal. So that's been my role in particular. But just, you know, we're actually talking about the annual report, so if I may just, you know, have a liberty of just speaking on the report itself. I think the report is really important. Again, as with Dr. Doddy's report, the format that we've got here is easy to understand, and people may go, 42 pages, I'm not looking at 42 pages, but in the way that it's laid out is a very easy to understand report. And I think one of the things that you know, I get all the time, and I'm sure as elected members we all get all the time, is, well, what do you actually do? You know, we pay all this council tax every year, and what do you as a county council actually provide? Because unless you have, you know, a child that may need some support, so you interact with us, or you have maybe elderly parents or relatives that need some support, so you interact with adult social care and health. Most people sort of bumble along, getting on with their lives, unaware of what's happening in the background and what is actually provided by the county council. They don't understand, you know, what the county council delivers, what the district council delivers, or what a parish council delivers. At the end of the day, they accept that these services are there, and it's only when there is a problem, really, do you sort of ask the question, who delivers what, and why and where, effectively. I think the report is very good in that it actually explains that the role of the county council effectively starts at birth, in that we register that birth. It goes all the way through education, support to young mothers, through all the health provision that we have from birth, all the way through to, you know, adult social care and health, and maybe in our later years when we're more needing of that support, all the way up to registering the death at the end of it. And I think actually that encapsulates exactly what the county council does in the range of services that we provide, whether it be highways, infrastructure, children, young people, adult social care and health, everything in between birth and death. This report actually, for those people who hopefully will take the time and trouble to read it, does identify some of those things that are all happening in the name of our residents that I'm sure otherwise they would be totally unaware of. So thank you for the report. That's me.
Thanks, Councillor Barnfather. And of course, the report also talks about how we will work to engage more so with residents on those topics and make sure that people do have that understanding, which I think is really important if we're going to be as close to communities and engaged with our communities as we would like to be. Further on my list, I got Councillor Barney. It's you again.
Sorry, folks. Yeah, me again. So just to begin, I'd like to put on record my thanks for having given the opportunity to serve in this role. Councillor Carlton and I have already been out meeting a number of our staff in different areas and also a number of beneficiaries of our service. And I have to say, I'm delighted to be in this seat, in this portfolio. Touching on what you just said there, the good that councils can do and achieve in our communities is amazing. And what this department with our able officers is able to achieve is extraordinary. And I'm thrilled to bits. Never in my wildest dreams did I think I'd be involved in such exciting and amazing stuff having been elected. So thank you for that opportunity. Just also thanks to Councillor Carlton here. Really pleased to have him as my vice chair. He himself, if any of you have taken the time to talk to him, is a passionate mental health advocate with lived experience. And I know that he's very keen to take forward a number of priorities with the whole mental health agenda, which fall as part of this portfolio. So grateful to have your help there, Scott. Also, just very quickly, because Boyd sat behind me as well, Councillor Elliott, grateful for his custodianship of this portfolio over the last few months. He's left it in very good shape, and he's been very, very helpful to me in the transition, for which I'm extremely grateful. A couple of priorities and areas I'd just like to draw upon, which actually touch on Councillor Elliott's tenure in this position. Just extraordinary works which I think are worthy of highlight. Hemsley Road in Mansfield, one of our brilliant facilities supporting people with learning disabilities, but during COVID times it was able to diversify its structures in what it did and support those who had been directly affected by the COVID pandemic, people who'd faced critically life-changing circumstances through the pandemic, either through bereavement or through loss or through inability in other ways, were able to go there as a place of refuge for short-term breaks and be comforted and seek respite. And I'm so grateful for that service, for what they're able to achieve through those difficult times. And we take our hats off to them and to the officers who supported in enabling that to be diversified so quickly. Absolutely brilliant. And just to say, going forward, one of our key priorities will remain supporting our short break services, supporting vulnerable adults and those with learning disabilities to have a change from their daily routine lives and the monotony that they might face in another environment, in an environment where they can be themselves. And at the same time, of course, giving valued respite to those who care for them on a daily basis. So Scott and I absolutely will continue to keep the short break service as a key priority. Another area again to touch on, thank you Councillor Elliott for the work that you afforded at Brook Farm. Absolutely fantastic to see the 50 individuals who have been supported and helped there with the person-centred training plans that have been put together for them. These are highly tailored plans focused around an individual's aspirations and desires and needs, not directed from above on what an authority or what we think would be what the individual wants to see. And I think it's absolutely fantastic. So I'd like to just acknowledge the brilliant work that's gone on there at Brook Farm, and again just assure everybody that this will continue to be one of our key priorities. I think personally for Scott and I think, as I've already mentioned, Scott has a great interest in mental health, and I think he will continue to be a great advocate for this county in all issues connected with mental health. I have a long-standing interest and involvement with homelessness and homelessness needs, and I'm not going to be able to help myself in focusing resources where I can in areas to relieve homelessness. So that will be a key priority for me personally. Having met staff just in the last couple of weeks, I think one of the key things that Scott and I have identified is I think staff would like support just in looking at some of the antiquated and slightly clunky IT systems that they might have inherited, how we can make our staff lives better. And I think that's something that I think officers are keen to support us with in trying to achieve. We're very, very keen as a department to recognise just the incredible work our staff do. And Scott and I's focus will be on supporting them as fully as we possibly can, making this authority the best place for them to work. We want them to stay here in Nottinghamshire County Council, and we will support them side by side to enable them to have the best opportunities to do that with the best support structures and services. And finally, just to continue the work which we have already started and has been going on, enabling those in our communities to stay in their communities, surrounded by the people they love, in their homes, with their loved ones, with their relatives, with their friends, wherever possible in their own communities, and working closely with tomorrow's NUH programme as that unfolds in these early days to enable services to be delivered wherever possible in the communities for residents across Nottinghamshire in the places that they know and love. So thank you for the opportunity. Very excited to be involved, and really grateful for the support of our team. Thank you.
Thanks, Matt. It's really helpful, not least drawing out some of those very specific projects that put the higher kind of level context of the plan into something very local and meaningful. That's useful to hear. Councillor Anderson, did you want to say anything on behalf of Tracy in her absence?
I am. Thank you, Chairman. I would like to speak today about the three ambitions of the Nottinghamshire Plan that most strongly relate to the children and young people portfolio, those being ambitions 2, 3 and 4. Ambition 2 is about supporting communities and families. In this regard, the Department's priorities for 22-23 include developing family hub networks across Nottinghamshire to give children the best start in life. This will give parents, carers and children and young people access to local support centres where they can find a broad integrated range of help and support to assist them in overcoming challenges and building stronger relationships. Ambition 3 is clearly one of Nottinghamshire County Council's most important priorities, that of keeping children, vulnerable adults and communities safe. Over the last year, we have taken part in the independent review of children's social care as one of 10 deep dives sites, a process where our services are identified for detailed, in-depth examination. Through this work, Nottinghamshire was highlighted for its good practice in leading a sub-regional commissioning approach to children's care across Nottingham, Nottinghamshire, Derby and Derbyshire, aiming to both improve the number and quality of homes locally and to reduce cost. The Council's transformation programme are well positioned to take forward any changes arising from the review recommendations. We have the opportunity to build on existing plans to strengthen our early help offers to children and families, remodel the way families gain immediate access to help, support and protection, and to provide multidisciplinary support to families whilst increasing the support to friends and family carers. Our priorities in 22-23 include increasing the number of foster carers and residential homes supported by Nottinghamshire County Council and recommissioning supported accommodation for children in our care aged 16 and above. So we are able to find high quality, safe and stable homes to meet the needs of children in our care. We welcome the publication on Monday of the independent review of children's social care, which will inform our work and plans going forward. Ambition 4 is all about building skills that help people get good jobs. Our progress so far includes increasing school places. In the last year, the County Council has added at Carlton Academy 300 places, Brookside Primary 15 places, and Christchurch Primary 125 places. We have delivered building improvements, including new school halls, new catering facilities, a redesigned heating system, and external works to playgrounds, which includes drainage and security fence improvements. East Markham Primary School, Albany Infant and Nursery School in Stapleford, and Dean Hall Primary School in Cornton have been amongst those to benefit from this. We are currently spending over £4 million to create more than 80 additional special school places, which will be developed in the next 18 months. And we have ambitious plans to develop another 20 million to create more specialist provision in those places where it is most needed. Our priorities in 22-23 include developing the Council's response to the Schools Bill, which proposes a fully academised school system while ensuring that Nottinghamshire continues its role championing the needs of all the county's children. In summary, we have a very full and busy programme and are highly committed to supporting the needs of the children and young people of Nottinghamshire. Thank you, Chairman.
Thanks, Sinead. That's really helpful context and highlight some of the national policy interaction that we're going to have going forward, not least the McAllister Review, Send Review, Schools White Paper, and all the change that's happening on that level, just like adults services, is going to be a lot of work to do to understand and make sure that we're working alongside those priorities. That's helpful. Councillor Cotty.
Thank you, Leader. Back at February meeting for our budget, I did mention some of the things that the Communities Committee had achieved, and also going forward for the annual delivery plan, some of those things were in there. But I would like to just touch on some highlights from the end of last financial year that I wasn't always aware of at the time, or we were seeing what we'd actually achieved in that period. So one of the important things from the library point of view is that we have the 6 new village hubs that are going to be improved, with £170,000 from the Department of Culture and Media and Sport through the Arts Council. And those villages of Burcoats, Billsthorpe, Blidworth, Burton Joyce, Langold and Woodthorpe libraries will all be getting upgrades this year to make them into community hubs, even more so than they are now. Another point that I'd like to bring forward, and thank you to Councillor Barnfather for mentioning and talking about registration services through births, deaths and marriages. I'm aware that our staff, through difficult times for our residents, supported bereaved families who were unable to be with their loved ones at that time of the COVID-19 pandemic, and I know that they did an excellent job supporting those families. And also from the fact that in 2021 to 2022, we've carried out 3,600 marriage ceremonies, which is quite outstanding for the service. And I would say thank you to those staff who went well beyond what was expected. We know the Household Support Fund, and there's funds out at the moment for this school holiday coming, and we'll continue to fight our way through that and support our communities. An interesting fact that came under my attention from the catering services and the county enterprises food. So for the last year, how many school meals do you think we've produced? No, I want to keep my job. But it's 9 million. 9 million school meals we've produced. So again, outstanding work done by our staff. We are, of course, supporting the Ukrainian families coming here. I can report that up to now we have 500 families here with us in Nottinghamshire. We are expecting the same amount again in the near future coming to us. I'll move on to the delivery plan on one or two things that we are moving forward on. And that's, although registration have done such a great job, we are going to do a review in this financial year coming forward to see if we can improve it even more. and that work will start very soon. Also, on the delivery of the grants that we get, see how we can push with government to ensure that we can support our communities in the short term going forward. Also, just to revisit the libraries, we aren't closing any. So I just thought I'd mention that. And one last thing as well is the... Yes, it is, yes. I haven't seen the concrete evidence yet. But we also, with our green spaces, we do have 90 special green places. There are some of those going to be looked at in the next 12 months, and also work with Sherwood, Rufford, Bestwood and Cotgrave Country Parks going forward to improve the, should we say, facilities for our residents. Also to say thank you to my, I was going to say vice chair, but my deputy cabinet member, Tom, for the last 12 months. We enjoyed working together, and I'll keep giving him the odd job to keep him going. So thank you, Chairman, for being able to put forward those points.
Thanks, John. That's helpful. Keep giving Tom the odd job. Keep him busy. Some of those stats, 9 million meals, is incredible, isn't it, from that perspective? And an example, as Councillor Barnfather said earlier on, of the things that we deliver that people wouldn't realise that we deliver from that perspective. So lots to shout about. I'm going to break it up slightly at this point because we're halfway down that list, and just for to pique everybody's interest, I've had a notification that Councillor Fowler wishes to speak on this item. Do you want to come in at this point, Kate?
Yeah, that was a bit sneaky, but yeah, okay, that's fine.
Not intentional. We could just go around if you want.
No, that's fine. Okay. Yeah. Okay, that's fine. Yes, yeah, so thanks. Thanks for giving permission to speak. I mean, we were a bit disappointed, I have to say, that you refused some of our spokespersons permission to speak. I mean, I'm just faced now with a situation where I've got a whole kind of huge document to comment on single-handed. And I think it's a real shame. I mean, and I think you could have had a really, really good input from the Labour kind of front bench on this. And I cannot possibly represent all that kind of knowledge and experience. So perhaps one of the things we can put on the list when we do meet is actually how we can make that happen, because it would have happened, wouldn't it, in a policy committee, more so, and it can't happen here. The scrutiny arrangements are still quite prescriptive from what I can say. I mean, I don't know how it's going to work, and I'm happy to, as you know, we'll work with you. We want to make it work with you. But at the moment, we're feeling quite hamstrung, to be honest with you, and I think perhaps that's something that we need to work through. But as I say, you know, responsible group, let's keep talking, but rest assured we will make our voice heard. Okay, so I'll have a go at kind of going through some of this. Okay, and I think one of the issues as well is in terms of kind of order. I mean, we've not had the opportunity to raise any of these issues before this meeting, so Cabinet coming first, I think probably actually has caused some of the difficulties, whereby we feel as if we can't make our voices kind of properly heard. Okay. Just to kind of a little bit of an aside, I'm really glad that you're not closing any libraries, John. It's a shame there's nobody here from the Independent Alliance to hear that. It's interesting, isn't it, that, yeah, that they're not actually, they haven't asked to speak. They're not here representing their constituents. Okay. Right, in terms of the annual report itself, just some general comments. This annual report is meant to be kind of an update summary of the council plan, but if you actually look at it in terms of accessibility for the general public, it's actually quite difficult. And I'm not suggesting this is deliberate, but I'm just saying I think some work could be done to actually kind of make it better. It's kind of really not clear. I mean, council staff have done a fantastic job of putting together the website. It is much better. There's quite a lot of videos of you speaking, Ben, I notice, which is understandable, and your cabinet. But I think you've mentioned, I mean, Chris mentioned some length, public engagement. And if you're going to get public engagement, you've got to make the information kind of a bit more accessible and a bit more user-friendly. And I think at the moment it's really not. I mean, the point of a council plan is that the public can clearly see how your manifesto commitments have translated into a practical plan of action, and then make their own judgment on whether you're delivering on your promises. So I suppose what I'm asking is, can you please put the Nottinghamshire plan in one place in a user-accessible, friendly document, and not kind of, it looks a little bit buried at the moment. And I just think that's something that, in terms of broader understanding and wider public engagement, that's something that really perhaps we could look at. I think certainly the layout's better, and thank you to Isabel, and thanks to Councillor Lawton Frank for setting up that meeting. I had a very interesting and useful discussion, and I understand that they're kind of factored in future. So thank you for that. I'm a little bit... the other thing as well, if you look generally through, and again, I won't go through it sort of piece by piece because clearly I haven't got the time to do that. There are still some clear gaps in terms of success criteria and baseline numbers. There is quite a lot of measures where there's no genuine comparator data, and I think it is out there. I just think we need to look at it kind of a bit more carefully. And again, I know work's been doing on that, and I'm sure that's kind of ongoing. Okay, I think though, if you look broadly across the piece, there's an awful lot of very good words in this, and it's great, and I'm really glad particularly to hear stuff that Councillor Lawton was saying about early intervention. That's absolutely key. But there is still an issue on clear success criteria, clear evidence that it's delivering and it's working. I mean, just to give some example, I mean, let's be clear, there are 30,000 more children now receiving food parcels in this region than there were 5 years ago. There's a rising number of people in work poverty. A lot of people who are really poor are working and working hard, sometimes with several jobs. The economic inequality in the county is rising. And people are being paid £500 a year less than the East Midlands average. And I know you believe, Ben, that this is going to be addressed, particularly around perhaps the DevCo and the Freeport. I hope it is, but again, there are promises, but clearly that's not happening yet. So it'll be good to kind of see some evidence that that's likely to happen.
30 seconds, Kate.
Okay, right, okay, because I won't go on more then. And just to say, we're independently ranked the third worst in county councils on climate emergency. So the number of things I'm just a little bit concerned with, if you could just a little bear with me. The mental health issue. Please don't put all this on schools. They are absolutely on their knees. We want more people out there delivering services, not just kind of like perhaps somebody just kind of out there kind of giving advice. And I do hope academisation will not get in the way of schools being able to deliver good pastoral support as well as curriculum support for their children. The SEND, I could go on at length at that. I'm really glad that there's a really good commitment for SEND, both in children and adults. Very last thing, if you could just bear with me, because clearly I'm not going to go through it all. Ambition 10, Forward-Looking and Resilient Council. You say on page 106, the County Council has been working with other councils and you want to give the region a bigger voice, more money, more major decisions made locally, near the people they affect rather than in London. There is no, in the plan itself, there is no success criteria for that. That is not mentioned in the forward plan. I think that's something that really should address. It's something that we come back to all the time. Again, our districts and boroughs are really, really concerned that they're being sidelined when it comes to devolution, and it's not in your plan.
Quite, and with good reason. I think the reason that we can't go into that level of detail in our council plan is because it's not just a matter for our council, and that's not something that we can dictate to Derby or Derbyshire or Nottingham as to what that has to look like. That's a matter of negotiation, as we've discussed at length. I think the point around input from the Labour group or other opposition groups is a matter of seeking to understand what this meeting is for and what other forums are for within the council. Perhaps the reason, I can't speak for them, I don't know if this is the case, but perhaps the reason that Ashfield Independents haven't put in the number of requests to speak is because they operate a cabinet system at Ashfield and recognise how that structure works in terms of what engagement opposition members have typically within a cabinet structure. I think it's worth noting really that although I think you're probably referring to call-in in terms of it being prescriptive, the opportunity for scrutiny and through scrutiny, it is really not at all. It's entirely up to the scrutiny panels and to the overall scrutiny committee what they choose to scrutinise, and the council plan would be a perfectly good and reasonable thing to scrutinise through that mechanism, including the delivery points that you've made. I think the key thing that I want to flag, and as I say, maybe it seems blunt at this stage, but I think we need to make this point clear and early on, is that there are those mechanisms, and whilst the points that you've made there are valid ones and matters of discussion, this cabinet forum is about, and the point of it is interaction between cabinet members to make decisions. That's why I'm saying that those things that are urgent and are relevant to the decision on the paper need to be flagged here if they can't be flagged anywhere else. But everything that you've raised there are points that we've been discussing at length in the background. There's nothing kind of urgent in terms of our decision today. So there are all sorts of other mechanisms like full council, like scrutiny, like individual conversations as we have behind the scenes to try and raise those issues. So just really want to be clear about what cabinet is for and what it's not from that perspective. As I say, there is no right to speak at most cabinet structures as far as I can see around the county, nor in government cabinet. And really, those matters are things there that we have considered at length over the past 12 months. The council plan, for example, far from an urgent thing to raise general discussion points around the council plan in this meeting, we've been talking about that for a year. So it's not in the context of an urgent or new thing to raise for us to help us make a decision from that point of view. So as I say, I'm sorry if it comes across as exclusive. I don't think that it is. I think it's more inclusive than most other such structures, but I think we just need to get our heads together and understand, as I say, what a cabinet meeting is and what it's not. And it's not a committee from that perspective. So we'll take those comments away, as we always do, and we'll come back to those in due course. But if you want to speak to Councillor Elliott, of course, about that scrutiny function and what is possible to bring forward and what's not, and we'll have a further meeting on that conversation in the next week or two. I'll move back on to our cabinet members and what points we want to raise. I think I got to Councillor Girling. You were next.
Yeah, thank you, Leader. First of all, I'd like to thank Councillor Cotty for yet again bringing up about Hucknall Library not closing. And I'm curious, really, although I suspect I know the answer, whether or not he's received this concrete evidence yet, and I doubt it. And in fact, I see Councillor Wilmot is listening in, and he used that concrete evidence as justification for him saying that there was going to close in the first place. So maybe he could pass that concrete evidence on so we can have a look at it. But anyway, I've looked at the plans of what we've done and what we're going to do, and a lot of my stuff really is what we've done. It's what is going to continue to happen. So it's not look at what we've done and now our priorities are different or anything. So I'd just like to run through a few of the things that we've been involved in. Obviously, the main problem we had at the beginning of this term was the recovery plan from COVID. So we did a lot of work, and I'd like to thank the officers for the effort they put into that to come up with an economic recovery plan, which is a really good document. And one of the things we've done, which is different, is it's not going to be sat on a shelf collecting dust. It's a live document, and it'll be adjusted as and when we see how we're recovering from the pandemic, because there's still elements that we don't really know how it's going to pan out. So that's one of the things. We've had things like the growth hub set up so that businesses who were looking to start up have got somewhere to go to get the information and support, or businesses that are looking to expand can go to it and use that as well. And so that's a big project that's going on. We've obviously now got the Forest 5G technology thing and the drone technology that's going on and doing all the tests for that. We've been criticised, why do 5G in a forest? But actually, it's a really good place to do it, because if you can make it work in a forest, you can pretty much make it work anywhere. And so that's a really exciting project, of which I think the officer involved has been put forward for awards in terms of her hard work on that. Schools, we've been building schools. We've extended schools to help the capacity, and I think that's a really good thing as well. So we're recognising what Children and People Services are requiring, and we're doing the stuff that needs to be done with that. We've been involved in the Community Renewal Fund, and it's not just what we put in, it's what every district and borough puts in as well. So we're involved in any elements that might impact on the county council on that. The same with the levelling up funds that districts and boroughs have been putting in, and the town funds that districts and boroughs have been putting in. So we're really active in terms of working with our district and borough partners in helping them achieve their ambitions within their own areas. We've also got the Top Wiggy development that's come through, which is the largest sort of scheme that this council has done ever, of which is going forward, and there'll be planning applications going in quite soon, I believe. We've also done a piece of work in terms of ensuring that developers pay their fair share. Yeah, and it's a really extensive piece of work, and it gives us a bit more power to go to the districts and boroughs and say, look, this is the sort of money we need. These are the reasons why we need it. It's really important that you make sure that the developers pay for it. And it's for things like roads infrastructure and actually schools. So where we need a school because of the development. So, for example, in Gateford, where they're actually going to be building a school there. We also have been involved in the apprenticeship levy and helping young people to get into work through that. And so there's lots more Leader, and I could go on and on and on, but I'm not going to. The one thing I'd like to finish with, really, or two things I'd like to finish with, is one, it's really in my capacity as the Armed Forces champion. And we've heard about the mental health issues and things like that, of which we get involved in with the Armed Forces family. But we are a gold award in terms of our employment status in that, and I'm very proud of that. But I'd also like to sort of thank Councillor Lee and Councillor Henry as the Armed Forces advocate, because they've really engaged with it and are putting their backs behind what we're trying to do for the Armed Forces family as well. So I'd like to thank them for that. And then the last thing I should do, really, because he's behind me, is thank Reg, because Reg attends a lot of the outside companies, bodies on my behalf, and I'd really like to thank him for all he does there. Thank you, Chairman.
Thanks, Keith. And as you say, again, cross-cutting across the council, really, in terms of the involvement, particularly property and some of those elements that are vital. So helpful to draw that down, I think. Just a couple of members left. I've got Councillor Jackson next.
Yeah, thanks very much, Leader. Just as a general point on the entire, both reports really, we couldn't do any of this without sound finances. And it's because of some pretty tough decisions we've taken over the last 5 years that we can start to really deliver on this. It's great to see the document is living, and as Keith's just said, it's not sat on a shelf gathering dust. And I think, with no disrespect to previous administrations of both political colours, it's been something that's done at the beginning of an administration, perhaps not looked back at as regularly as this. I really welcome the fact that we're going to look at this annually and hold ourselves to account for it. If I can just, because it's coming up to lunchtime, if I can just touch on page 107 and the COVID Outstanding Response Award. I think we should be very proud of the procurement team here. And I can play top trumps with Councillor Cotty because they only delivered 9 million school dinners last year, whereas the COVID-19 response procurement team collectively distributed over 15 million items of PPE. We never ran out, despite huge pressure, not just delivering internally to county council establishments, but John Doddy's nodding because delivering to GP practices, delivering to partners right across not just Nottinghamshire, but the city of Nottingham as well. I've talked before about the scale of stuff that was coming through this building because it was the most sort of centrally located building we had. When we weren't all here during lockdowns, it was being very, very well used. I might even say more productively than when we're sat in this chamber sometimes. But we really should just have a nod to the team who did just such an outstanding job during that period. Thank you, Leader.
Thanks, Richard, and excellent point. I'm going to ask the comms team to come up with a set of public service top trumps cards that we can use to engage the wider public. My children will enjoy that immensely. Good. Councillor Wheeler.
Thank you, Leader. Just to explain, my deputy hasn't gone for an early lunch. He's gone because we've got a school council visiting us today, which I mentioned to our leader earlier on. So he's welcoming them today. It's a school which sits in between both our divisions. And they'll be in this chamber at 1 o'clock to engage in a mock question and answer session with some councillors. So we're really looking forward to that a bit later. It won't surprise you that because we put people at the heart of everything to do, so that's largely what I'm going to be talking about in a few minutes. I mentioned very earlier on, and Councillor Barney, about apprenticeships. Now, on page 19 of your report in front of you, that's there, right at the top there. We recruit a new team leader to ensure successful delivery of the skills, employment and opportunity strategy. We have over 240 apprentices. We're really proud of that. The team's benefits include training standards, internal audit, business intelligence unit, public health, and adult social care. We have difficulty, though, on what we can spend a levy on. We feel a more flexible approach is needed. My Deputy Jonathan has met with the leader and with officers. We prepared a letter for the leader to send to Treasury officials. Our proposals are constructive. You want the Treasury officials to engage with us on the review of the apprenticeship levy. We also have a very, very successful graduate development program. We're so proud of that. Very soon, we'll be whittling down a list of the candidates who applied to us, and be followed by an assessment centre for those who have been shortlisted, and a new cohort will start on the 29th of September. So very, very good news indeed, both in the apprenticeship and the graduate fund. I hope you all agree. We have continued to improve on a lot of things, but in particular Notts app. I know Councillor Girling and I spoke about the Notts app recently, and he applauded the work that's been done on it. That's been done by our customer service team. My deputy and the service director and I went there yesterday. We mentioned this to them, what a wonderful job they've done on it. And you talk about a buzz and engagement with our people. My goodness me, that was there yesterday in huge amounts. They've done so much work, but they want to do more, and we want to work with them to encourage more of that. What was lovely to see so many people back in the workplace there yesterday as well, the buzz and the atmosphere there. And I've never come across anything like it, to be honest with you. It was just absolutely wonderful. And I would encourage, and we'll talk more about that, to visit them, because they are just amazing people, as are, of course, our entire workforce. Earlier this year, we approved the personal strategy to 2022-2020, so looking forward, which set our priorities for the next 4 years to ensure with the right people, the right knowledge, skills, and work in a collaborative, inclusive way. We developed a strategy, not by ourselves. We listened to feedback from our employees, our managers, trade union colleagues, and our representatives. We wanted to be sure the strategy reflected the things which are most important to our people, who are, after all, and we keep never forget this, the most valuable asset we have. And together with Leader and senior management, we joined a number of virtual meetings where we launched a new leadership development program. Further modules on this, of course, are in the pipeline as well. Our people strategy for 2002 to 2026, earlier this year, is what we approved that. The high-level strategy sets our priorities for the next 4 years, as I mentioned earlier on. We want to make certain that our managers invest in their staff and their people, and we work with them collaboratively in making all of this happen. So our priority is very clear with them, working together, getting to know as many people as we can. Matt, you mentioned this earlier on, getting out and about, getting to meet our people. We started this week in a big way. This is going to carry on the next, well, roll forward. Not over the next what, just going forward, it's going to carry on. What I'm very proud about on Ambition 10, the Council was accredited as Disability Confident Leader in September last year, following detailed validation of our submission to Department of Works and Pensions. Achieving this accreditation represents our commitment to all our employees right across the organisation. We will continue to ensure the Council delivers against all the core actions as a Disability Confident Leader. In November, full Council, I presented a certificate of our Disability Confident Leadership to Martin Harris, the co-chair of the Council's Disabled Employees Support Network. We will carry on working with those groups. We will carry on working with Martin. It's not just a box-ticking exercise. We've done it. Here we go. Off we go. Well, that's it. No, we will do more work. We know we need to do a lot more work, and that will happen. We recently, finally, Chairman, you'll be very pleased to hear, we recently received a report from Robin Ash of the British Deaf Association, in which he identified where the Council is in relation to commitments made under the British Sign Language Charter. The then Personnel Committee, which, as a few weeks ago, approved the development of an action plan. I'm grateful to Robin and our own Taraj Singh on the huge amount of work they've already done and our commitment to address priority areas of work arising from the review. I've had a virtual meeting with some members of the BDA, and the feedback has been extremely important and very valuable to us. We take our responsibilities very seriously. Thank you, Leader.
Thanks, Councillor Reid. That's really helpful. I have to say, increasingly coming across our graduate trainees in particular in various walks of life in recent weeks and months, and been very impressed by the standard and the quality of the work and of their confidence and presentation and various other things that we've seen. So that's been fantastic to see. I've only got Councillor Clark left, and we might even finish on time, Neil, unless you choose to filibuster.
No pressure on you.
Come to kick in.
Oh, well, no pressure there then, Leader. All right. Well, yes, despite your comments, I do want to highlight, because the Transport Environment portfolio is an incredibly busy portfolio, as I'm sure you will agree. And I will highlight a lot of the aspects of it, but not all of them, because there's far too many. So in terms of road projects, they're both large and small. So one of the largest projects, the Colliery Way, which is the formerly known as the Gedling Access Road, and
we made the decision to continue that despite COVID, and so that has been delivered rather than pausing it. It's reduced journey times, it's giving access to affordable homes and businesses, and it's reducing congestion in Gedling Village. But in addition to that, we also planted 430 new trees. More of that later. On the smaller project side, but it's a big project, you yourself, Leader, were keen to instigate a highways review a year ago, and that has come out with unanimous 50 recommendations, cross-party, and that has been achieved, and it continues to be delivered, because obviously this is both an annual report and the delivery plan. And just a few of the highlights of that: a 3-year capital programme, so that gives certainty on the repairs that are going to be scheduled during the course of the next few years. The doubling of the number of repair teams with an extra £12 million investment that enables more permanent large patch repairs, moves the emphasis focusing on the local roads rather than main roads. But we also include maintenance of footways, gullies, verges and drainage to prevent flooding. Also, you were keen, Leader, we declared a climate emergency to achieve carbon neutrality by 2030. We've been developing a carbon reduction plan. Some of the highlights of that: plans for 170,000 trees as a contribution to reducing that carbon, developing and implementing greener highways, and that includes the management of trees, green corridors, road verges, etc. In terms of other environmental issues as well, we have implemented a review of the recycling centres to improve and maximise recycling rates, and that involves engaging with district and borough councils to ensure that we can recycle in the best possible way. In addition to the £12 million I mentioned, we've further £3 million investment in environmental issues, such as continuing and completing the rollout of the LED lighting, which saves energy and saves costs, so that is good for the taxpayers. We are piloting an electric vehicle on-street charging scheme to see how we can help those with electric vehicles carry on their programme of saving the planet. We've got the Green Investment Fund that helps us to protect the environment, and we've engaged on a green energy tariff to keep costs down. And not least, we've started to, and we will continue to invest in electric buses, which again helps, and we're back to that air quality, reducing the pollution effect on our air that we all breathe. Continuing with buses, £31 million investment in the improvement plan to maintain and enhance the existing network, and that includes also, as well as enhancing and trying to keep the bus services operating, but the innovation of services being available on demand, which is a different way of approaching the supply of bus services. And then just finally on flood prevention. We've been investing very heavily in flood prevention, both large and small projects. On the large project side, we've been working, and we will be working now with Severn Trent. I think you may know a little bit about this, Leader, £75 million project on the Mansfield Green.
76, Councillor Clark.
Oh, 76. It's got, you see, costs keep going up, Leader, you see.
Hot air's cheap, though.
And on a slightly smaller scale, gentlemen to your right probably knows a little bit about this, the Southall Flood Alleviation Scheme, which is a mere only £6 million. So, but then to much smaller projects, but they are also extremely important. Flood Wardens Scheme, encouraging volunteers to help with closing roads during times of flooding. And we've had events helping to train those wardens and thank them for all the work that they are doing in supporting our communities. But hopefully to help reduce flooding, a better maintenance regime for gullies and verges. And so just to finish off, in keeping with my other colleagues, I'd also want to thank my Deputy Cabinet Member, Mike Adams, who is not here today, but he is also wearing that hat of Environment Champion as well to support and help take this very busy portfolio forward in the future. Thank you, Leader. And it's only just gone 12:15.
It was a good effort. Thank you. And yeah, brevity is appreciated. No, there's all sorts going on in your portfolio, as you say, not least key priorities that we've laid out as a council and loads of work to be done. I hope colleagues will forgive the time that it takes to go around the table, but I think it's important for us all, and the point in many ways of this meeting is for us all to collectively understand what is going on in each different area of the council, for us all to be able to dig into the breadth and the key priorities of the work that underpins the council plan. And the council plan is a unique agenda item in some ways in that it does cut across everything, but all the more reason, I think, to really understand what the work we are doing as an authority is that feeds into that plan, because it is, as has been said, a live document that we need to hold ourselves to, and important that Councillor Elliott, opposition members and others are able to pick up on those priorities that we raise and the commitments we make in this forum to hold us to account over it. So I will ask Cabinet members to return to this, and one of the recommendations is to continue to review this in the future, but those updates are helpful, and I think members will feel it's helpful to, in your own minds and your own portfolio, to return to those key sets of priorities. What is it we are trying to achieve and deliver to help us collectively hold ourselves to account on those issues? So that's been helpful and much appreciated. All that's left, I think, for me to do then, and we'll draw the meeting to a close, is just to vote on those agenda items. So we've got first agenda item number 6, which is just to note the achievements listed in the annual report. I have all those in favour. Thank you very much. That's carried. And finally, to approve the Nottinghamshire Plan, annual delivery plan, and recommendations about bringing that back for further scrutiny and updates in the future. All those in favour? Thank you very much. That is approved, and it draws us to a close on our first and most exciting Cabinet meeting. So thank you very much for your time. We have finished early, and I'm eternally grateful.